So, what's the relationship with a research study? With me today is Dr. Shri Banerjee. Shri, do you want to introduce yourself?
Yeah, certainly. So I am a core faculty member of the College of Health Sciences. I have been in the area of public health for approximately 20 years. I have also worked with the Centers for Disease Control and also had collaborations with National Institute of Health and other health agencies. From this experience and my medical training, I use this to guide my students in the dissertation journey and also teach them quantitative skills. So that's a little bit about myself.
Yeah. So, we haven't actually told people what we're going to do yet. We're going to look at geospatial analysis, which I know absolutely nothing about. So, why don't we start there and tell us what it is?
Sure. Thank you, Dr. Stadtlander. That's a really good first question. I think um, one way to think about geospatial is I like to start by, breaking apart the term. And if you're thinking geo, so if you think about the um, uh, term geo, uh, that means Earth. So you're starting to kind of think globally. And so when you start to think about anything related to maps, anything related to geospatial, you have to kind of take a step back and look at things in a global scale. Um, and so you learn to appreciate um, the map in a different way when you learn all of these complexities. And so if you start at that global map and then kind of work your way more specific areas, so looking at the national, state, local, then this would be a good first step exercise to understanding how maps function.
So, what's the relationship with a research study?
Yeah, that's now a good question. It's important for students to first understand, you know, how specifically geospatial considerations may fit and align with their topic. So um, it's good to start with kind of a simple example and one that I'd like to use as an example because not only have I seen many patients with diabetes with this condition, but also I've personally lost loved ones. So if we take a chronic condition like diabetes and then think about how we can apply spatial considerations, um, then at a very basic level, if we think even of the incidence, descriptive statistics, right? Incidence, prevalence, mortality rates, all of these can be mapped spatially and variations can be observed. So if we think about diabetes, you can quickly take a look at the map and look and see where there are clusters of diabetes and where there are less incidents of diabetes. And so you can look at these observations. And so once you understand where that relationship lies, then you can advance the research and make more observations.
So, it's more of a descriptive tool, kind of almost qualitative, in that you're describing where the
Right. So if you take the first step in understanding how to approach geospatial, it almost feels almost more as a qualitative appreciation of the data. And so so that is the beauty of geospatial analysis because it's true that initially you are making kind of qualitative observations where there are clusters, what areas seem to have more clustering. But as you try to understand the relationships even more, once we try to understand if there truly are clusters and if they're statistically significant, if you can, without reasonable doubt, say that there is a cluster, then there are certain specific statistical tests that are used to try to delineate and understand that.
So you would be getting what kind of data? I mean, to analyze.
Then at that point, once you have qualitatively, and I use this term loosely. I'm not necessarily referring to the whole area of study, qualitative study, but kind of an appreciation of the data. Once you do this qualitative evaluation, then you begin to understand and conduct spatial joins and additional sort of unique unique tools that you use in geospatial analysis to try to understand these relationships quantitatively. And so you're still using some of the familiar statistical tests that you think of, right? So like multiple regression is still part of the consideration when you're conducting quantitative analysis. But the difference is that now you're adding a specific type of weighting, which takes into consideration geography and geospatial relationships. Mm-hmm.
Can you give us another example? I like the diabetes one, that helped a lot, but maybe another example of a study.
Sure. And I can go back to a study that actually was presented um, last year at the National American Statistical Association conference, and actually went on to be published with the JSM proceedings. And this was actually looking at a relationship between um, income inequity as a focus focal as an explanatory variable, and understanding if there was a relationship with breast cancer. And so, uh, when we looked at, so I worked on this with Dr. Matt Jones. And so when we looked at the general regression, the multiple regression without geospatial considerations initially, there was a significant relationship. Now, but we were not just interested in that. We were also interested in something called the coefficient of determination, R squared value. Now, this R squared value, among many things, actually determines, and this is not just for geospatial analysis. This is, I'm referring to right now, multiple regression. This coefficient gives a sense of how strong the model is. How well the model performs. And so there was a pretty high R squared, but uh, as expected, when we included geospatial considerations into this model, this R squared increased. So the model with geographic weighting had a higher R squared than the original multiple regression. So that very fact clearly illustrated the point that geospatial relationships and geographic weighting really needs to be included into more and more models if we want to really have targeted interventions in communities. And I can explain that statement a little bit more. So what I mean by that is that the findings that are that are there now can be applied if the analysis is conducted, for instance, at a county level, right? So a lot of this information is available at the county level in several websites, like countyhealthrankings.com or countyhealthrankings.org. And so a lot of these variables, you kind of bring together and understand what is going on at the local level. So once you understand that there's geographic variation, you can create models that inform what is going on at the local level, and then also use additional guidance from places like Healthy People 2030 and elsewhere to create interventions that will help promote healthy communities. So going back to the diabetes example, if there is a community where there is not enough eye care, or if there's not enough foot exams, right, then we can make that determination at the local level, and then create something that will remedy that.
So I'm visualizing some kind of software or something that lets you actually do a mapping type thing. Is that actually the case, or?
Yes, absolutely. There is definitely software that is unique to spatial analysis and geospatial analysis. And actually, as it turns out, there's several out there. And the leader in well, when I say the leader, the one company that has been around the longest, in fact, they have history since 1969, is Esri. So that's the name of the company. But they have manufactured a software called ArcGIS. If you were to Google this, you would be able to find this pretty easily.
And that's ARCGIS?
Yes, ARCGIS. But I did say that there were several. This one, there's a lot of additional resources that's out there with this software. There's also a cloud-based mapping platform that's out there. Students can easily sign up for an account become an online user, and from time to time there are deals where there are an 1 year free subscription to some of the resources.
Nice.
But the other software, which is open source, is QGIS. And there are similar features with that as well.
Is there any difficulty with getting access to data that works with this? I mean, can you just use like data from the health department, or is there something special you need to be looking for in terms of a
That's a
data?
good question. When you're accessing data and spatial data, actually this question arose during the pandemic, especially when there was a lot of granular data being released. What do I mean by that? In public locations, in state health department websites, in Johns Hopkins dashboards and other dashboards, many dashboards, there was a lot of sensitive data, potentially sensitive data that was being released, and also many guidelines and policies and regulations even were being debated regarding the release of information and how granular that can be. I've used the term granular several times, but what I mean is that when you're thinking about zip code level data, and when you are describing cases, or when you say there are three or four cases within a zip code, then and many people in that community know each other, then that indirectly I may identify the individuals. And so there were very complex policies that were enacted during a public health emergency that informed situations like that. So on a general level, when you're doing research geospatially, these are considerations that are important to keep in mind. Personally, I was trying to conduct geospatial analysis on the National Health and Nutrition Examination Survey. And so during the pandemic, the center was closed. And so I was unable to actually access the data because, not only is it sensitive data, but the access is dependent on circumstance, so if there's an emergency, if there's a pandemic or any sort of crisis, then that can influence research, as we have seen in many different levels.
Well, thank you. If somebody is interested in learning more about this, what would be the best option for them?
So what I would recommend is for people that want to learn more, they can visit ArcGIS. They have a lot of tools that you can access as soon as you sign up for the account. There's a lot of tutorials, and they're very helpful. But to truly get a full immersion, it's important to take, a course or multiple courses. I myself was so intrigued in this that I went on to receive my master's degree in this area. So from Johns Hopkins. So this was something that's near and dear to my heart. And like you, I also started from step one, not knowing how numbers and data translate into these colorful maps. And when I saw this, it just sparked my interest. So I encourage each and every one of you to visit some of these resources from ArcGIS and others, and do the same. Go on a path of exploration.
Thank you so much, Sri. I know faculty are going to be really interested in this and bringing it to their students. So thank you.
Thank you, Lee.
Thank you for joining us today for Research Talk. Our music is by audionautics.com, and I'm Dr. Lee Stadtlander. Today's podcast was sponsored by Walden University's Office of Research and Doctoral Services.